Welcome, everybody. This is Marise Frangie, the responsible practitioner of Study of Lebanon Fertility Care Center. I would like to welcome you to another episode from the series Women Healed in Their Own Words. Today, we're going to be reading a story from another category, prevention of preterm birth. And I'm so grateful that Therese Rodriguez is joining me for another episode. Therese, welcome. Thank you so much for being here.
Good morning.
Can you please introduce yourself for our listeners?
Yes, hello. My name's Therese Rodriguez. I'm a nurse and I direct metroDCfertilitycareRN in the DC area.
Thank you. So we are reading on page 163, the physician comments for the section prevention of a preterm birth, if you have the book. And remember, you can purchase the book from the St. Paul VI Institute in Omaha, Nebraska, and the link is in the description box below. Therese, would you like to start, please?
Sure thing. Okay, from Dr. Hilgers as the author. Prevention of preterm birth. Most people are not aware that the prematurity rate, defined as the number of babies born prior to 37 weeks gestation, has increased consistently over the last 30 years. In 2002, the prematurity rate was 12.1%. In the mid-1960s, just to give you an example, the prematurity rate was only 6.7%.
So it kind of doubled.
He says, this is a national tragedy. Premature birth is hazardous to the health of young children. Prematurity is a leading cause of cerebral palsy, mental and motor retardation, and other abnormalities. In addition, while a great deal of progress has been made in the medical care of these young infants, which is really very good, it is extremely expensive and drains the resources of an already challenged healthcare system.
It's true.
And some of this increase is due to the large number of multiple pregnancies, which have come as a result of the artificial reproductive technology programs for the treatment of infertility. Many of those programs average between 35 and 45% multiple pregnancy rates. This is contrasted, incidentally, with only a 3.2% multiple rate in naprotechnology. In addition, it is quite likely that the epidemic of sexually transmitted diseases has also had something to do with the increased risk of preterm birth in the United States.
Yeah, it's interesting to find out that there are many factors that had helped in increasing it. Over the last, yes, sorry.
Go ahead. I was going to say, for someone who's longing for a baby, they're prepared for one. Multiples are a blessing, but they are willing to accept many children at one time, even just for that normal one pregnancy. And there can be so many complications, not that multiples are a risk that should be avoided, but that just present more difficulties.
That's true, yes. Over the last 25 years, research has been conducted at Creighton University School of Medicine and the Popol VI Institute on developing programs to reduce the prematurity rate. The Popol VI Institute has developed a prematurity prevention protocol. It tells us here to check the medical and surgical practice of naprotechnology, Popol VI Institute Press, Omaha, Nebraska, 2004, which is a very thick book that many of us have, practitioners and medical consultants, and it goes through every medical and surgical practice of naprotechnology. This prematurity prevention program has decreased the prematurity rate to 7%, and it is rare for us to see a baby born before 32 weeks anymore. So that's great. This is all accomplished by educating the patient on the various symptoms of premature labor or uterine irritability, which is a precursor to preterm labor. These symptoms include pelvic pressure, cramping, low backache, the uterus knotting up like a ball, and generally not feeling well. Once patients are aware of these symptoms, then a specific program of intervention can be undertaken, which has been extremely successful in decreasing the preterm delivery rate. The program involves the use of progesterone support during the course of pregnancy, medications which help stop uterine contractions, the use of cervical circlage, a stitch placed in the cervix in indicated cases to strengthen the cervix. That's what the cervical circlage is. and then the judicious use of powerful antibiotics to treat underlying infection. So it's not just helping the patient by knowing the symptoms, but it also uses different protocols to help prevent it, which is fairly easy to be done, yet sometimes it's kind of ignored or dismissed in some cases.
The dismissing is a big piece.
Yeah,
It can
yeah,
be frustrating.
it is. It is. Yep, agree. So we are reading a story on page 165, in case you have the book, titled Two Full-Term Babies Achieved with Help of Institute by Colleen M. Lux. Therese, can you begin?
Sure.
Thank
She
you.
begins. I met Dr. Hilgers when I was 39 years old, pregnant, and with a history of 2 stillbirths and 1 child who was born with a heart defect. The following is an account of my story that ended with 2 successful, live, full-term births and totally healthy children. I would like to begin with a background. My husband and I had a very hard time conceiving our first child. I'll rephrase. My husband and I had a very hard time conceiving our first child. And we worked with a specialist, and after having my cervix frozen, we met with success. Our oldest son, Andrew, was born in 1983. He was born with a hole in his heart, which was successfully closed in 1985 through surgery. Amazing.
Yeah.
Shortly after his surgery, I was amazed to find myself pregnant without any type of medical help. Unfortunately, this daughter, Christy Jo, passed away in July of 1986. I was 26 weeks pregnant with her when we discovered that she had died inside of me. They induced me, and she was delivered stillborn on July 18th, 1986. An autopsy was performed, but there were no problems with Christy, and we never were given a reason as to why she died. A few short months later, I became pregnant again, and this child also died inside of me during my 3rd month. I had a D&C after discovering through an ultrasound that there were no signs of life. I then had genetic studies done, which told us that he was a genetically fine boy. Once again, we were left without any answers. After this, we went 10 years without being able to conceive.
I can imagine the heartache of losing the babies to begin with, or delivering stillborn baby, or having the DC for the other baby. But on top of that, no answer why this is happening. No explanation.
So hard.
Yeah.
So lonely.
Yeah. And then they struggled with infertility 10 years without being able to conceive, like stillbirth, miscarriage, and then the infertility. What a painful journey they went through. During this time of infertility, my husband's brother, who is a doctor, recommended seeing Dr. Hilgers so we could have more children. I kept his name as a reference in case I ever needed it, but chose not to actively become pregnant and open myself up to another loss. I decided that it would be up to the Lord if I ever was blessed with another baby. A few short years later, we moved to Omaha, and in less than a year, I discovered I was pregnant at the age of 39. The only doctor I would even consider going to was Dr. Hilgers. They discovered that I was extremely low on progesterone, and his associate was totally amazed that I was even pregnant due to my very scarred cervix. An ultrasound was performed, and I was definitely pregnant. Low progesterone and the scarred cervix. They started me on progesterone shots, and I had to continue with these throughout my pregnancy. Dr. Hilgers also added oral progesterone to supplement my low progesterone counts. I was on the most progesterone possible. I was due the latter part of April, and around Christmas I started having strange pains that were quite intense at times. I went into the clinic after the holidays and saw Dr. Hilgers. He discovered I was in a preterm labor and immediately performed a cerclage and put me to bed rest. My membranes were extremely thin, and to this day I am amazed that I was able to carry this daughter to full term. Along with the cerclage, Dr. Hilgers also put me on an IV therapy program that consisted of coming into the clinic 2 to 3 times weekly for an IV that contained antibiotics. The IV helped calm my uterus and worked miracles, as far as I am concerned. The nurses and Dr. Hilgers were my lifeline during the next 3 months. My only trips out of the house consisted of going in for IVs and progesterone shots. The rest of my time was spent in bed, as when I was up, the pain was too intense, and I was doing everything possible to carry this baby full term and not lose another child. I'm sure if she wasn't seeing Dr. Hilgers, that would have not happened.
It's unbelievable what the attention can do.
Yeah, yeah, definitely, definitely. I remember a few months ago, I was helping in an education phase in South Carolina, and I interviewed one of the interns there. I have the interview on my YouTube channel. She had shared with me a story about having low progesterone during her pregnancy and begging her doctor for progesterone, and the doctor would not take it seriously, and she ended up miscarrying. Then, thank God, she was able to find an apo doctor who gave her progesterone, and she carried her baby to term. It's something that simple, yet so many doctors don't want to acknowledge how important it is to help women carry pregnancy to full term. So sad. Therese, would you like to continue? You're
Sure.
mute. Yeah.
Okay. On April 4th, 1997, our daughter Claire Catherine was born at Bergen-Mercy. Dr. Hilgers induced me on that day, and we welcomed our healthy 8-pound baby into our lives. I did end up with complications from hemorrhaging and was quite ill for a couple of weeks, but eventually healed. In January of 2000, I discovered I was pregnant again. We were very surprised with this pregnancy too, but also quite glad that Claire would have a sibling to grow up with. I ended up in preterm labor again, but we were very aware of this possibility happening. Dr. Hilgers ordered frequent ultrasounds to check my cervix, and we knew right away when it was thinning out, and I paid more attention to the pains that I was again experiencing. Once again, Dr. Hilgers performed a cerclage and put me on the same IV therapy as before. I also underwent progesterone shots and oral progesterone pills the entire pregnancy. Since we knew what to expect and look for, I did not end up on bed rest at all during this pregnancy, which was a blessing. I also had frequent ultrasounds to check the baby's breathing so we would know when to have the C-section. It was amazing to see his lungs progress, and on September 29th, 2000, we welcomed a 9-pound, 9-ounce son into our family. We named this baby Charles Otto after his great-grandfather. Sorry. This is my wonderful little one.
That's great.
So joy with children.
Yes, yes, beautiful.
And she finishes, as I'm writing this, our children are now 26 and 3, and all are a blessing. I firmly believe that without Dr. Hilgers and his wonderful staff, I would not have Claire and Charlie. They worked miracles for us.
Beautiful, beautiful. Yes, probably her oldest son would be a lonely child if she had not met Dr. Hilgers, who had helped her carry Charlie and Claire to full term.
It's quite beautiful.
Yes.
The experience going through it can be so lonely, feeling dismissed, feeling like you're just isolated. But to have the answers and the fruit, actually, like we're promised in the spiritual life, abundant life.
Yes.
It feels abundant, even if it's a small joy and growth
Yes.
in the family.
Yes, and the story like this, I'm sure they give hope to people who've been struggling with a premature birth or stillbirth. So if you're out there and listening, just click share on this video so that women who need to hear this story will get to hear it. Couples who are struggling with similar situation will get to know that help is available and they don't need to keep on suffering like this couple was suffering for so many years. Don't keep this for yourself. You can be an instrument of helping others find real help and get real care and attention for their own case. And remember, this book is available through the Institute. You can purchase it as a gift. I give it to someone who will benefit from those stories. Therese, any final comments?
Oh, it's just a joy to be able to join others in their journey and know that that welcoming of help and just camaraderie and conversation really can help open up doors.
Yes, thank you. For more information about the Creighton model and NAPRA technology, you can check the description box below the YouTube video. And remember to like, to share those videos, podcasts with other people. We want to help spread the word. We want everyone to know about NAPRA technology and fertility care system, because we are here to empower every woman, every girl, and every couple with this knowledge. We want you to discover what you have the right to discover. So don't keep that for yourself and share it with others. Help us to spread the word. Thank you, everyone, for tuning in, and have a blessed day. And thank you so much, Therese, for being with us in the second episode.
So welcome. Thank you.